This is Kamara Daughtry, and I have a very special guest with me, Dr. Galiatsatos of Johns Hopkins Hospital right here in Baltimore, Maryland. He is actually going to tell us what the effects of tear gas is doing to our respiratory system. We know a lot of people during this unprecedented time with a lot of protests going on. We've seen the images and we have seen really the videos of tear gas going into people's eyes. But Dr. Galiatsatos is really going to dive into how this affects our lungs. First and foremost, thank you, Doctor, for joining us today. We are very excited that you are here. And can you first just give us a little background, what you specialize in?
So I'm a pulmonary and critical care doctor. So that does imply that I deal with the lungs and all things related to the lungs, both preventing lung disease as well as managing of lung disease. And then on the most extreme end, though, being a critical care doctor means I'm in there in the intensive care units, managing organ dysfunction and organ failure when they're at their most extreme, threatening someone's life, for instance. And oftentimes that organ tends to be the lungs. So the most extreme interventions for helping out rather complicated lung pathologies happens in the intensive care unit where I'm also present.
But when you really saw people being tear gassed, Dr. Galiatsatos, what did you say to yourself being in the intensive care unit and dealing with the respiratory system?
So I'm going to respond to that with two hats, right? As a doctor, of course, and especially a lung doctor, my first thought is, as people are inhaling that, first of all, it's good to see a lot of the protesters, they were wearing masks, keeping in accordance with recognizing the pandemic is still present, but those masks are not going to prevent the particles of tear gas from getting into their respiratory system. And the purpose of the tear gas is to create discomfort, right? To try to pause people in that moment through some level of discomfort that will halt them. But that discomfort is going to be different for everyone, right? So if you have a pre-existing lung condition, such as asthma, that the noxious stimulants, the chemicals of tear gas may result in really dire consequences where they're going to have an asthma exacerbation, an asthma flare. So yes, as a lung doctor witnessing that, my heart goes out in 2020 in a country that should stand for all its people to see that happening is it is upsetting. And so that pivots me to kind of the second hat, just as a human being. The protests out there are for justice. I can't see anyone arguing for that against that. And the tear gas, to me, it's a complex conversation around what we are all demanding. So the doctor in me, my heart goes out because I know that can have dire consequences to a variety of people. And then just the human in me, just there's anger there. We're advocating for justice. That's it.
Dr. Galiatsatos, what are the effects that tear gas can really have on a person, long term and short term?
So again, great question, Ms. Daughtry. So the proximity of the tear gas will be a huge impact on how severe the consequences may be. So the closer you are to where the tear gas first came out means there's just a higher concentration of those noxious chemicals. So you're more likely to develop symptoms. The further you are from it, less concentrated, more diffuse chemicals, so potentially may not have as dire consequences. But right off the bat, once they are inhaled and make their way into the lungs, our airways of the lungs, where air goes in and comes out, they're meant to be kind of a really protective barrier to try to identify, is the air coming in fine, good, or not? So, anything that we breathe in that has the potency for being a noxious stimulant, such as air pollution, right? Our bodies will try to close those airways in order to stop the movement of that air and get it back out. But that closure of the airway will create symptoms. So for some people, it will result in a cough or a bit of shortness of breath. But for those with asthma, it might become, right, that reaction tends to be really severe. So coughing and especially shortness of breath starts kicking in. So those are the two most immediate symptoms that you'll see from the lungs, coughing and shortness of breath. And depending on someone's pre-existing conditions of airway disease, right, say they had asthma, they're likely to have those symptoms just much more amplified. Other symptoms, of course, is a high output of mucus, right? So anytime you have a bad noxious stimulant come in, your lungs are going to try to create a barrier from keeping that from coming into the body. So creating a thin layer or thick layer of mucus is one way to prevent chemicals from trying to get into the lungs or any kind of noxious stimulant. So you're going to have the coughing, you're going to have the shortness of breath, and then you're going to have an output of just secretions, right? So one's out of your lung as you cough them out, even in the upper respiratory system where your nose begins to run, your eyes begin to water. All of that is meant to kind of be the body's defense, right? Kind of a lubricant in order to keep the chemicals from coming in. But at the same time, that kind of response also carries its consequences for people where, having a congested nose makes it harder to breathe, coughing up all this phlegm makes it harder to breathe. So the body's response to these noxious chemicals is important because the body's just trying to keep them from entering the bloodstream and so forth. But at the same time, it's going to create symptoms that are going to be really discomfort for many people, as well as potentially life-threatening for others. And again, it goes back to those with prior pre-existing conditions, or having a baseline of asthma and other lung diseases. I bring up asthma just because it's just the most commonly known. But people going into this that may know that they have a prior pulmonary condition, I applaud them for doing what they're doing, going out and reporting. But if I was your doctor, I would say please just carry caution because that noxious stimulant is not good for your lungs.
And this is really interesting because you also talk about pre-existing conditions. And as a respiratory doctor at Johns Hopkins Hospital, and you are in the intensive care unit with COVID-19 being prevalent right now, how can people even cope with this COVID-19 and tear gas? What are things looking like in the intensive care unit?
Right. So, before the unrest has come on, the many ICUs across the country are finding themselves greatly impacted by COVID-19. A lot of resources are being utilized to care for these patients. And it's both quantity and quality. So on average, when a patient would come to a hospital pre-pandemic, usually they're staying in hospitals anywhere from 2 to 5 days, especially in an ICU. These patients with COVID-19, because we don't have a cure, right? So everything we can offer is just supportive therapy until their bodies clear out the virus. Many of these patients can be in our hospitals anywhere from 2 weeks to 5 weeks, up to 30 plus days. So that's taxing on any hospital because not only do you have a patient that comes in, but they're there for almost 30 plus days. So that's currently during the pandemic. And the unrest that's happening for social justice, justice doesn't wait. I get it. Pandemic or not, we need to address this. But my caution to all my colleagues, to my friends who want to go out and make their voices heard, is just continue to abide by these public health requests. The public health requests that we put out didn't take into account a potential unrest that we are seeing now, but here we are. And we need to be able to not let justice wait. So what I would say to everyone is, continue wearing the face mask, continue hand sanitizing. If you can stay socially distant, I would strongly abide by that. The other thing to keep in mind that I want to voice is when you wear face masks, and I get at protests, people do want to be loud.
Right.
My only concern with that is a lot of these face masks, the turbulent trajectory, so meaning like how much air comes out of your lungs given a cough, a scream, or a yell, or singing, a lot of that can actually disrupt the face mask in of itself and its integrity. So you won't see a hole or anything, but you can still push the virus through the layers of fabric because of just how much air comes out. So I say this because prior to the protests, I would be on calls with churches and really discuss with them singing should be held to a tone that's no different than just talking. So my plea for my colleagues who are going out and protesting is, the face masks work really for normal speaking volumes. If you have to be loud, please try to grab a megaphone so you don't have to do much yelling. You can just speak into something that can amplify your voices. So for the protests, I would strongly urge microphones, megaphones to go out to keep people from having to yell, because that can actually, the turbulent trajectory of the air coming out could still result in the virus spreading out. So I say this because I'm mindful that we need these protests. We need these peaceful displays of a demand of justice now. And so I want to be able to advocate for that in a public health manner. So wearing face masks, finding ways where we can amplify our voices through microphones, megaphones, and so forth. Obviously, signs do it just fine without speaking. And then going back to the original conversation around tear gas, I mean, I I don't know how to stop the proximal risk factor of, having the tear gas sent out. But what I would really strongly encourage is when you see the tear gas come out, it's, try to gather as many people in an organized fashion to move back. Just the closer you are to it, the more likely you are going to get to inhale these noxious stimulants that will result in health consequences. And Ms. Daughtry, you asked a question about long-term consequences.
Right.
I think that's hard to say right off the bat. For a lot of people, it's just going to depend on potentially some pre-existing conditions. So for some people that have an asthma flare, they'll tell you like their asthma flare doesn't go away the next day. It lingers for months on end. So the long-term ramifications really is going to depend probably a lot more on pre-existing conditions, and then to some extent, how much of that chemical you breathe in. So if you're really, really close to it and you breathe in a high concentration,
Right.
could be long-term consequences from that.
I know a lot of people, doctor, talk about social distancing. When we look at these national and even local protests here in Baltimore, because I was a part of one in Baltimore, but I remained 6 feet away. I tried to remain at least a social distancing length that doctors and the CDC provides. But I mean, what is your response to the protesters who are bundled together, who are in masses marching? I mean, is this going to really increase the spread, or what do you think?
Right. So I think this is our first ever protest in a pandemic.
Right.
Or let me put it this way, a protest for a social just cause, right, in a pandemic. So I really would strongly encourage, the original playbooks we had for a good, peaceful protest, we suddenly have to adapt to it in a time of pandemic. So I would strongly encourage the social distancing. We cannot let our guard down at this time. I know institutional racism has plagued and contributed a lot of morbidity and mortality, but at the same time, so is COVID-19. And when we break the social distancing, COVID-19 is there to sweep in. So my plea to yourself, to the journalist, is let's still abide by this. Our voices can still be heard pretty darn well at a socially distant manner. I just don't want one public health concern to blind us from another public health active issue, right? The social justice with regards to COVID-19. So I would just plead to still be mindful for that. And then, as you said, then you have tear gas on top of this as well. So the virus could spread in addition to these noxious chemicals. And what we don't know is, we know COVID-19 is bad for the lungs. We know tear gas is a discomfort to the lungs. If you have these two together, I don't know I can only imagine there will be a synergistic, dire outcome from that. So I would really just strongly encourage people to still abide by these CDC recommendations of social distancing, wearing the face mask. And if you see tear gas, just try to be as distant from it as possible.
Right now, for the current climate for COVID-19, do you see the cases increasing or decreasing, even as we open up with phase 1 and phase 2?
Yes, so it's hard to say. The hospital is going to be a biased barometer because we're going to, if you have 100 cases in a day or 1,000 cases, you're still going to see that steady flow come in. Right. So from a hospital standpoint, it still kind of waxes and wanes, but for the most part, still seems to be high cases. It hasn't seemed to go up, so it kind of seems to be kind of more of a flat curve overall, kind of a steady pace of admissions. And you're right. I mean, those were steady state of admissions during really strict interventions, right? Public health requests of stay-at-homes, of lockdowns, and that's great. My concern as every doctor, nurse, scientist, public health official, as we phase into this, what the outcomes will look like, we don't know. And I will say this: this virus, this pandemic, unlike your other natural disasters that have a time and place of an ending, right? We don't know. We have no idea when the pandemic will end. So I understand the need to try to assimilate and to try to adapt to this. I get it. I imagine it's going to come with some trial and error. For every step forward, we may have to take 2 steps back. So right now, what I can say from a hospital perspective, we're
Right.
seeing still a steady flow, and we're holding our breath to see what it looks like as we phase in.
And we know that, especially because I lived in New York right before the pandemic hit. It was about March 16th when I officially moved here, and that's when everything really started shutting down and stay-at-home orders started being in place. But originally from Atlanta, I saw that, Atlanta doctors from Emory Hospital, they were going to New York hospitals to help intensive care units for COVID-19 in Queens and Brooklyn and Manhattan. So, and I know their bodies were tired. So if you can, and I know, and I just want to say thank you, because you work every single day and you have a strong immune system and you work to help people build their immune system. So thank you very much. Last advice, doctor, what would you tell people during this time, even as we are fighting for social justice? What would you tell people on how to stay safe? What would be your last recommendations if they hear just this part of the interview? How would you say, listen, this is a way that you can stay safe, and this is a way that you can really protect others around you?
Ms. Daughtry, at this moment where we need to come together for a moral and ethical cause around justice for all, what I would just recommend is keep in mind we're still in a time of a pandemic. So please continue, when you go out, wear face masks, bring hand sanitizers with you to keep your hands clean. Try, please, to be as socially distant as possible. And then to make your voices heard, I would strongly encourage signs. That way it minimizes how much you have to speak. And if you feel like you're in a position to make your voices heard, try to have an instrument such as a megaphone or a microphone to amplify your voice. Because again, the louder you speak, the more turbulent trajectory particles come out that can actually cause the face mask to lose its effectiveness. So those would be my recommendations. And I would say, for everyone out there, I promise you, many doctors and nurses are here to take care of you if, God forbid, you suffer any dire consequences from the tear gas and so forth. We're all in this together, honestly.
Thank you, doctor. LookWeAreIncluded.com would like to say thank you, and I am so glad I connected with you through Brian Waters. You are excellent. You are absolutely excellent. And we're going to have you back in LookWeAreIncluded.com to give us
Please,
more information, to keep
please,
us safe and
yes.
living a lot longer. Awesome. Thank you again, and thank you for being a health hero. You are a hero.